In general, patients would rather avoid surgery than go through surgery. And so when I get asked about alternatives to a facelift, it really depends on somebody's anatomy. So there's three main things to think about when it comes to aging face changes. The skin is part of it. If you've been a smoker, if you've been in the sun a lot earlier in life, how animated you are, how thin your skin is, thick your skin is, that all that affects what the skin quality is itself. So there are things you can do to address the skin, whether that be lasers, chemical peels, retin-A, even dermabrasion. And so there's different things you can do to address the skin itself. Then you can talk about fat. The fat in the face, unfortunately, tends to go away a little bit as we get older. And so as you lose volume in the face, there are aging changes there. So I tell people, look, a 90-year-old man or woman looks more like a raisin than a grape compared to, say, a 20-year-old. And so that volume loss also plays a role in aging. And then the third one is tissues become less elastic as we get older, and so they sag. And so it's really a question of what your issues are. And if the sagging is by far the biggest component, then you're going to do the best with the facelift. But if you have a lot of volume loss and you got some skin changes, then there are less invasive options as far as fat transfer or filler or other skin treatments that might be beneficial. It really comes down to your individual anatomy.